payment mechanism, you have social insurance, your Medicare and your Medicaid. Medicare is federally funded health insurance for certain persons over 65. And then you have Medicaid, it's federally funded, state-operated program of medical assistance for people with low incomes. And then you have workers' comp. For sure, no Medicare and Medicaid. Whenever a program is federally funded, typically speaking, it will be state-run. In other words, the qualifications for Medicare may be different in the state of Florida than they are in the state of Illinois. Not really the qualifications, that's not the right word. The coverage, how much they cover. And the same thing with Medicaid too. It varies. The biggest thing to know about Medicare and Medicaid is that it can vary state to state when we're talking about funding. And we have reasons for increased costs. There's technology, inflation, specialization, increased utilization, increased personnel, increased paperwork. So technology, we all know that there's more and more diverse tests that we're getting done. If anyone's had an MRI and has had to pay for that, they kind of know the cost of having an MRI. If anyone's ever even been to the emergency room for something very minor, not anything too serious, you can get the hospital bill and see how much money it is. Then we have the factor of inflation, specialization, the doctor's fees, and when you go to orthopedic specialist, of course it's going to be more money than going to a regular MD. Increased utilization, you're using, I'm not exactly sure what this means. I'm just thinking that you're using the medical facilities more often. You have increased personnel and increased paperwork.